thank you so much for being here. I think before we begin, I would love for you to tell all our viewers a little bit about your practice and yourself.
First of all, thank you, Samara, for bringing me to your platform. And I feel you at CARER are doing a fantastic job. And I feel very proud to be associated with you people here. And coming to myself, so my name is Dr. Sajjan Rajpurohit, and I'm a senior cancer specialist at Max Institute of Cancer Care in New Delhi. So I have more than 15 years of experience as an oncologist. And I always have been fascinated by this fact that oncology care is not only medicine. So it requires a lot of care beyond that, which includes the integrative elements, and which I feel probably you are going to provide in India. And I think it's a unique concept, or probably first of its kind, which I have come across.
I know that you had an association with MD Anderson, one of the biggest and very reputed hospitals in the world. I also know that MD Anderson has one of the most established integrative medicine units. So what is your thought process coming from that school of thought, being exposed to integrative oncology over there, and then having a practice in India?
Yeah. So Samara, when I was at MD Anderson Cancer Institute, I actually was working with the melanoma and lymphoma research there. And the best thing which I found about MD Anderson is that it's not an institute, it's kind of a city. So it's kind of a medi-city which is there. It has got huge number of buildings, association, institutes for different aspects of cancer treatment. And in fact, they also have a huge program for integration of complementary and associated medicines also, along with the kind of treatment which we follow and which we do. And that is what I think which is required, that in today's world, we need to have all those aspects integrated into cancer treatment. That is what will bring the best results out of the oncologist treatment, as well as these important aspects which we sometimes often are not able to ignore. So we are ignoring in our routine practice, because as oncologists, we are quite busy. But those departments are essential, especially psycho-oncology, the nutrition support which these patients require. These are very important aspects of overall outcomes of cancer patients.
Have you seen some of your own patients improve, a considerable amount by implementing these kind of therapies into their treatment?
Yes. So, Samara, I have been very lucky that I've worked at very nice institutes. In fact, when I was working at Rajiv Gandhi Cancer Institute, also we had this thing important and integrated into our clinical practice. Same way, when I'm working at Max Institute of Cancer Care, we have a dedicated team which works for oncology nutrition. We have people who are working for palliation and psycho-oncology. So we have our doctors who are providing those supports to our patients, apart from the main treatment which we give as oncologists.
That's great to hear, Dr. Sajjan, because so many hospitals around like the country they're still lagging in when it comes to really giving integrative and comprehensive end-to-end care. So I'm really happy to hear that Max is doing this.